Well, right now, President Trump urging Republicans to keep working on a health care bill after the latest effort collapsed in the Senate, after saying this yesterday about bringing Democrats to the table.
I think we're probably in that position where we'll just let Obamacare fail. We're not going to own it. I'm not going to own it. I can tell you the Republicans are not going to own it. We'll let Obamacare fail, and then the Democrats are going to come to us and they're going to say, how do we fix it? How do we fix it? Or how do we come up with a new plan?
Well, let's bring in our medical panel. Dr. Cathleen London is a practicing family physician who's on the board of New York Doctors for America. Dr. Marc Siegel, a familiar face, Fox News medical analyst and professor of medicine at NYU Langone Medical Center. You know, listening to the president there, I'm reminded of the words of Gene Kranz. I believe it was Gene. Anyway, the Apollo 13 communications guy who said failure is not an option. Is that an option here, to just let Obamacare fail?
So first of all, let's characterize it what it would be. It's not letting it fail, it's choking it to death, because it would mean pulling out all the subsidies and taking them away. And that's really not an option. That would put millions of people's lives at risk. I now practice up in rural Maine, so I'm actually now in the Maine, the director of Maine's Doctors for America, and our critical access hospitals would potentially close. It's not like New York where you have hospitals all over the place. It's from where I practice, it's 45 minutes to the nearest hospital.
Well, is that one of the problems? I mean, you know, members of the Senate and House get great medical treatment. Most of them come from population centers.
Yes, they saved their health care in this bill. So the problem is you can't cram a bill through in a month, and you can't have 13 white men go off to a room by themselves with no input from physicians, hospitals, or anybody. Even insurance companies were against
that. But there are tremendous problems with Obamacare, which was foisted on the American people.
I think that's the point the president's trying to make. How well is this working when 6.5 million people a year take the tax penalty rather than buy into the insurance? That idea that everyone was going to be forced to buy in insurance to cover everybody else.
Which is a right-wing idea.
Well, that doesn't make it right. That doesn't make it right or wrong. That idea, cost sharing, is not necessarily the basis of a workable health care system. John, here's what I mean by that. I mean that premiums are soaring. I mean that deductibles are too high, so people have to pay out of pocket and they can't afford to. I mean that we have narrow networks of doctors. I mean there's a huge physician shortage. You know what it's like? You add cars to the train, but the wheels are falling off the train. Or you don't have an engineer, or you don't have a conductor.
Some of the things he just brought up, the high deductibles, the cost shifting to patients, that's not Obamacare. That's insurance companies. Let's separate where the evils lie. No question these things need to be fixed. But you can't do it this way. Right now, we do need to shore up the markets, and then let's take both sides back to the table, and let's really solve this issue, which there are a number of ways to do. We have Medicare. We know how well that works in our seniors, and that is a cost-sharing initiative. 20% isn't covered. That's similar to France's plan. That is one way we could do this.
But a part of the problem is that Obamacare mandates so much coverage for some people who just don't need it, right?
Exactly right. So
that's how insurance works.
That's not how insurance works. That's one way insurance works. You don't pay the same for your Ferrari insurance that you pay for your Toyota. The government wants to take responsibility. It can pay directly for those who are most in need. Here's how you do that. You add a catastrophic option, and then you say for those with pre-existing conditions, we're not going to let the premium soar.
That's what we had before the ACA.
That's where the government comes in. Here's the other thing you do, and here's the big mistake the GOP made. You separate out the Medicaid question. Medicaid is responsible for 12 million people on these exchanges. This is where the negotiating should have been. I'd like to see the Democrats and Republicans go to the table, try to preserve the Medicaid expansion, but while doing so, get rid of some of the excess, John. There's so much waste in Medicaid. I've worked with Medicaid all my life. You know that 20 years ago, I decided to start seeing Medicaid patients for free? You know why? It wasn't worth it to file the paperwork. Physicians are not reimbursed properly. They're running away from Medicaid. 31% of new physicians won't see new Medicaid patients.
You two have disagreed on a lot of things, but I think I saw a nod of agreement on that.
I lose money on my Medicaid patients. That is true. I'm not saying to expand Medicaid out to cover everybody. I think we do need to innovate, but we need to learn from the rest of the world. Things that I would do, and I've written about this. I've got op-eds in The Hill about this. I would expand Medicare out to the essential benefits. I mean, we know everybody needs preventive services. That we know. We want our kids to get their well child checks. We want people to be screened for their blood pressure and cholesterol and diabetes. That should be everybody. So if we have a Medicare-type plan for everyone that has a 5% overhead versus insurance companies, so that all gets covered. Your emergency care all gets covered. And then we put out the rest to do something like our Medicare Advantage plans that already are sold nationally.
Yeah.
That you can choose what level you buy or not.
We're going to have to leave it there. A couple of doctors.
Basic insurance for all, catastrophic for all, is not a bad idea. It goes all the way back to the 1970s.
All right. Dr. Marc Siegel, Dr. Kathleen London. Good discussion. Thank you both.
Thanks, John.